Assalamu alaikum wa rahmatullahi wa barakatuh. Today we'll be explaining the second anatomy lecture of the CVS block. So bismillah, let's start. First of all, we need to know that this lecture is going to be divided into two parts. The first part is going to be about the pericardium. So we're going to talk about the pericardium, the difference between the fibrous and serous pericardium, and the pericardial sinuses. But then the second part is going to be about the heart. So we're going to talk about the borders and the surfaces of the heart and the structures of the heart. Tamam? So, starting off with the pericardium. What is the pericardium? The pericardium is a fibroserous sac that encloses the heart and the roots of the great vessels. يعني كأنها كده كيس that covers الheart والvessels for protection. تمام? So, this pericardium is divided into two parts, the fibrous pericardium and the serous pericardium. The fibrous pericardium is the most outer layer. طيب يعني أبعد layer من الheart. It's the most outer layer. خلاص? And it's very it's rough and it's dull. يعني it's not shiny or anything. It's rough and dull and it's the most outer layer. بعدين the serous pericardium is divided into two parts, the parietal and the visceral. Let's see them here because it's more clear. Here in this diagram we can see good the first or the most outer layer is the fibrous pericardium. بعدها this white area is going to be the parietal pericardium. بعدين هنا the one in red is the visceral pericardium. Between the parietal and visceral we have this blue area is known as the pericardial sac. This pericardial sac is filled with fluid. So it's filled with the pericardial fluid. تمام? So the fibrous pericardium and the parietal pericardium are usually together because they're both the outer layers, okay? But the fibrous is the most outer layer. بعدين the most inner is ايش قلنا? The visceral layer. How can we remember it? Just an easy way يعني to remember. V is for view. Okay, so V for view. So when you're close, you have a better view. So that means the visceral is the closest layer to the heart. It's the one that's stuck to the heart. تمام؟ لأنه it has a good view. طيب, this is just to remember it يعني. So in the middle here we said we have the pericardial sac which has the fluid. Here we can also see it here in this diagram. The one in green we said. Sorry, no. Let's start with this. The one in white is إيش? Is the fibrous pericardium. And then the one in blue is إيش? The parietal pericardium. And the one in green is the visceral pericardium because it's the closest one to the heart. With the part in black in the middle is إيش? The pericardial cavity or the pericardial sac that's filled with the pericardial fluid. تمام? So كده we know the layers now. Okay? Let's see the fibrous pericardium. The fibrous pericardium اللي هو قلنا إيش? It's the most outer layer, this one. It's the most outer layer, it's the one outside. Oh, and برضو I forgot to say something here, that when we cut the parietal and the fibrous layers, the inner layer is going to be shiny, خلاص, and it's going to be smooth. Why? Because it's the closest layer to the fluid, because it's attached to the fluid. But that's why we said the outer layer is إيش? Is rough and dull, and the inner layer is shiny and smooth, لأنه it has fluid close to it. تمام? So, the fibrous pericardium has an apex, a base, anterior surface, posterior surface, sides or lateral surface. Okay, so let's see the boundaries حقت الfibrous pericardium. What are the boundaries of the fibrous pericardium? First of all, the apex. So we need to remember something. The apex of the pericardium and the apex حق الheart, we're going to talk about this in the second part of the lecture about the heart. But just to remember, the apex of the heart is underneath, or it's in the lower part. And the apex of the pericardium or the fibrous pericardium is here. It's on the top. تمام? So هما معكوسين. And how can we remember it even more? An apex is always the pointy part. يعني the more pointy the area is, or the more كده يعني curved it is, that means this is the apex. So here the heart, obviously, this is the curved part or the apex of the heart because it's more curved. And this is more broad, so we call it the base of the heart. أما في البريكارديوم العكس. في البريكارديوم, this is the more, we can see, this is the pericardium, the one in gray كده. So this is the pericardium. The more curved area is on the top. So that's why this is the apex of the pericardium. And this is the base of the pericardium. So the apex of the pericardium is surrounding إيش? The great vessels اللي هم الأورتا, superior vena cava, pulmonary trunk. طيب? So this is the apex of the pericardium. أما the base, where is it? It's attached to the central tendon of the diaphragm. يعني it's attached to the central tendon حق الdiaphragm here because it's the base. تمام? بعدين the anterior surface. Anteriorly here we can't see it لأن this is not a 3D model, but anteriorly it's attached to إيش? It's attached to the sternum. How is it attached to the sternum? It's attached with the sternopericardial ligament. If you remember the sternopericardial ligament, where is it? We mentioned it in the first lecture هنا. We said إنه It's one of the structures found in the anterior mediastinum. And we said it's very important لأنه it's the only structure which is unique and it's found in the anterior mediastinum. So the sternopericardial ligament is the one that attaches the anterior surface of the pericardium to the sternum. تمام؟ يعني هي اللي تمسكهم في بعض. تمام؟ بعدين on the sides we have the phrenic nerves. So on the sides here we can see we have the phrenic nerves and the pericardiophrenik vessels. بعدين posteriorly we have here we can see posteriorly we have the 4 pulmonary veins. So posteriorly we have the 4 pulmonary veins. How can we see the posterior surface of the fibrous pericardium if we remove the heart? يعني هنا this diagram هنا we remove the heart. And here we can see this is the anterior surface of the heart and we can see everything the heart has. If we remove it we can see the posterior surface. So on the posterior surface it has the 4 pulmonary veins. Okay? So now moving on, here we have, I just rearranged these slides. So these 2 slides were supposed to be at the end, but I brought them here because it made more sense to be here. يعني. So, but it's the same slides, I just changed the arrangement. يعني. So, the nerve supply for the pericardium. What's the nerve supply for the pericardium? We said the nerve supply, or the pericardium أصلا is divided into 2 parts, the fibrous and parietal, and the visceral. We said these 2 are the outer layers, and this is the one that's close to the heart. تمام? The fibrous and parietal, their nerve supply is going to be the phrenic nerve, and we need to remember it's C3 to C5. We already studied this before, but we need to remember it عشان maybe in the exam the doctor brings C3 to C5. She doesn't bring phrenic, maybe, I don't know. طيب, so remember that the phrenic nerve is C3 to C5. تمام? This is the nerve supply for the fibrous and parietal layers. But then for the visceral layers we have the vagus nerve. Okay? Something else we need to know, very important, is that the fibrous and parietal layers are the layers that are sensitive, so we can sense pain. يعني لما نحس بألم في one of the layers of the pericardium, it's going to be the fibrous or parietal layer. It's not going to be the visceral. The visceral is painless. You can't feel any pain. خلاص, for the visceral layer. Why is that? لأنه the phrenic nerve supplies other areas other than the fibrous and parietal layers. Okay? So for example, if a patient feels pain in their shoulder, it doesn't necessarily have to be because of the pain in their shoulder. يعني the problem isn't the shoulder, but it's known as referred pain. So the pain is actually from the pericardium, the fibrous and parietal layers of the pericardium, but the patient feels it في the shoulder لأنه they have the same nerve supply, which is the phrenic nerve. Okay? So these are the nerve supplies. Now the blood supply. The blood supply, برضو, we're going to divide it. The fibrous and parietal are going to be alone, and the visceral is going to be alone. So for the fibrous and parietal layers, we have descending aorta, pericardiophrenik artery, and musculophrenic artery. تمام? So these are the 3 blood supplies for the fibrous and parietal layers. We can remember it by DPM. Okay, so DPM are the blood supply for the fibrous and parietal. DPM are the blood supply for the fibrous and parietal. تمام? بعدين for the visceral layer, we said the visceral layer is the closest one to the heart. It's the one that's stuck to the heart. So here, friends with the heart. So anything that's going to supply the heart is going to supply the visceral. So what's going to be the artery or the blood supply that supplies the visceral is going to be the coronary arteries. And the coronary arteries are the blood supply for the heart itself. So they're going to supply the visceral layer معاهم. Okay? Now let's see the sinuses. So we have 2 pericardial sinus. We have the transverse pericardial sinus and the oblique pericardial sinus. طيب, these 2 sinuses, what's the importance for them? Or specifically the transverse sinus, clinically, what's the importance of transverse sinus? It's important in surgeries. So we can insert or we can place the clamp here, a surgical clamp here, so we can stop or control the blood flow during surgeries. If, for example, we want to cut something or anything in the arteries, so we can control the blood flow with these clamps. Okay, so where do we place these clamps? We place them in the transverse sinus. And for example, if we want to cut here this area, we're not just going to place a clamp here and then cut, because the blood is going to fly everywhere, right? So we have to place the clamp here and place another clamp here, and then we can cut this area in the middle. Okay, so this is the clinical importance. Now let's see the boundaries of the transverse sinus. So the boundaries حقتها ايش? It has anterior and posterior boundary. Anteriorly we have these 2 اللي هم ascending aorta and the pulmonary trunk. So anterior boundary of the transverse sinus is ايش? The ascending aorta and the pulmonary trunk. Posteriorly, what does it have? It has the 2 atria اللي هم the right and left atriums. We can't really see them here. Okay, but they're in the posterior border of the transverse sinus. Now the oblique sinus. The oblique sinus, we can only see it if we remove the heart. And here, this is the same diagram we saw here قبل شوي. Here, so we remove the heart so we can see the oblique sinus. طيب? When we remove the heart, we can see this area in green is the oblique sinus. Okay? So, what are the boundaries of the oblique sinus? Anteriorly, يعني هنا in front of it, before we removed the heart, what was the anterior border? It was the left atrium. But why? How did we know that? لأنه the left atrium is the one that has the pulmonary veins. طيب? So here we can see the pulmonary veins. So the anterior boundary of the oblique sinus is the left atrium. طيب? The posterior boundary إيش? Are the content of the posterior mediastinum اللي هم the ones we mentioned in the first lecture هنا. The content of the posterior mediastinum يعني the esophagus, thoracic duct, descending aorta, azygous vein, all of these content are the posterior boundary of the oblique sinus. بعدين on the left and right, what do we have? On the left side, we have the two pulmonary veins, the two left pulmonary veins. On the right side, we have the two left pulmonary veins ومعاهم inferior vena cava. So we have the two left and the inferior vena cava on the right side. Okay? So كده we saw the boundaries of the oblique sinuses and the transverse sinus. طب? Now, here a very important point that the oblique and transverse sinuses are both separated by إيش? By the left atrium. In the left atrium بيفصل the two sinuses عن بعض. So here we can see this is the transverse sinus and this is the oblique sinus. In the middle, we can see the left atrium separates both of them. Okay? Now, pericarditis. What is pericarditis? Pericarditis is the inflammation of the pericardium. So the pericardial fluid accumulates excessively in the area. Okay? What does this cause? Here we can see in the x-ray, we can see the heart is very enlarged. Why? لأنه there's inflammation. Okay? And what does this cause? It causes a lot of problems. Specifically, what does it cause? It causes a compression to the atria. So when the atria is compressed, there's less space, so the atria can't fill the heart with blood, so the blood can't pump enough blood to the body. Okay? Because the atria isn't filling enough blood أصلا. There's no space. Okay? So what's the solution for this, or what do? We do pericardiocentesis. Okay? So we have to insert a needle. Where do we insert the needle? The site is very important. We insert it طبعا to the left لأنه the heart is إيش? Is to the left. So to the left of what? Of the xiphoid process. And we go to the sternum, we see the xiphoid process, and then we go to the left of the xiphoid process, and then upward, backward at a 45-degree angle. Upward, يعني فوق, backward, 45-degree angle. Why does it have to be specific? To avoid pneumothorax. طيب? لأنه by accident, if we insert the needle in the wrong area, then we're gonna rupture the lung. Okay? So كده we're done with the first part of the lecture, which was about the pericardium. Now let's move to the second part about the heart. Okay? So where is the heart found? It's found in the middle mediastinum. In the first lecture, we divided the mediastinum: superior, inferior, middle, anterior, posterior. So the heart is found in the middle mediastinum. تمام? The size of the heart, what's the size of the heart? It's a closed fist size. يعني قد معصم اليد. Okay? And then the shape. What's the shape? It's a conical shape. يعني قد كأنها cone. Looks like a cone. Okay? And it has an apex and the base and three surfaces. Okay? If you remember in the beginning of the lecture, we said the apex and the base of the pericardium are opposite to the apex and the base حق الheart. So the apex of the base حق pericardium this was the apex of the pericardium and this was the base. تمام؟ أما في الheart, it's going to be the opposite. This is going to be the apex of the heart. خلاص? And then the base is going to be in the posterior part. We're going to see it now. So we said we have three surfaces. Our surface is the anterior surface, and the second one is the posterior surface, and then we have the inferior surface. تمام? Each surface has another name. We have to know both names for the surfaces. Okay? So anterior surface is also known as sternocostal surface. Posterior surface is known as the base of the heart. Inferior surface is known as diaphragmatic surface. Okay? So we have to know the names for the other surfaces as well. Okay? Now let's see each one in details. So for the apex of the heart, it's a cone shaped. We said لأنه it's pointy كده. It's a cone shaped or a pointed area, and the direction is downward to the left. خلاص? So it's downward to the left, and it's a pointed or cone shaped area. تمام? What forms it? The left ventricle only. This is very important. So the apex of the heart is formed by the left ventricle only. تمام? And where's the site? Exactly, يعني where is it? We're going to depend on the sternum and the ribs, okay? Or the intercostal space. So we're going to imagine that this is the sternum and these are the ribs, تمام? So we're going to count the intercostal spaces. يعني this is 1, 2, 3, 4, 5. Once we reach the fifth intercostal space from the midline, which is going to be the sternum, we're gonna move approximately 3.5 inches. So we're gonna move approximately 3.5 inches, and then we're gonna find the apex of the height. تمام? So this is the site of the apex of the height. Then we have the base of the height, or also known as the posterior surface. Then we said the posterior surface, the other name for it is the base of the height. So most important thing is, the posterior part of the height, or the posterior surface of the height, is formed by the two atriums. يعني ما فيها ventricles. Can we see any ventricles? No, we can't. This is the left atrium لأنه it has the pulmonary veins, and this is the right atrium. The ventricles are not very clear. يعني هنا we can just see part of it, okay? But we can't see the full ventricle. So in the posterior surface, it's formed by two atriums. Remember that, okay? And mainly which one has the biggest portion? What can we see the most? The left atrium. So it's formed by the two atriums, but mostly, or the most part is formed by the left atrium, okay? And posteriorly, it's related to the posterior mediastinum. Here in this diagram that we said, when the height was removed, so this is the part where this part, or this diagram, is going to be attached. تمام? So these are for example, the veins, okay, the pulmonary veins, the aorta, the trunk, and the vena cava. All of these, if we see them in this diagram, we can see their openings, okay? So this is the place where the diagram below is going to be attached. تمام? Just to imagine it يعني. So this area is going to be posteriorly مع posterior mediastinum. So that's why we said posteriorly it's related to the posterior mediastinum, and the posterior mediastinum separates it from the vertebra. لأنه in the first lecture we said, when the diagram the posterior mediastinum, and here. So this is the posterior mediastinum, صح? So احنا قلنا the height is in the yellow part, it's in the middle. So the height is here, and then we mentioned the base of the height. The base of the height is going to be here. حيكون related to the posterior mediastinum. والposterior mediastinum حيفصلوا عن حيفصلوا عن vertebrae, right? And which vertebrae? The T5 all the way to T8. So this is the area. Wait, let this go. So this is the area exactly where the base of the heart is. Okay, so it's not here, it's here. But if we compare it to the posterior surface, it's going to be T5 to T8. تمام? I hope it's clear. I'm trying to make it easy to imagine. So try to imagine it with me. This is the heart هنا قلنا. This is the base of the heart because it's in the middle mediastinum. The posterior part of it is the posterior mediastinum. بعدين ورا البوستيريور mediastinum في الvertebrae. So which vertebrae exactly? T5 to T8. تمام? This is what's written here. بعدين we have the other surface which is the anterior surface. الانterior surface عكس الposterior surface. الposterior قلنا it's formed by two atriums. أما الانterior it's formed by the two ventricles. Okay? So we can see here part of the atrium, but it's not very clear. يعني مو the full atrium. We can just see part of it. So it's formed mainly by the ventricles. تمام? And mostly, or the most part of it is formed by the right ventricle. So if you realize they're the opposite. In the back, in the back we can see more the left atrium, or in the front or in the anterior surface we can see the right ventricle. A way to remember it, I just made this up to remember, anterior surface is always right, okay? So remember, the anterior surface is always right. The posterior surface is always wrong, so it's always left. تمام? So anterior surface is always right, posterior surface is always wrong. So the anterior surface is going to be formed mostly by the right ventricle. The posterior surface is going to be formed mostly by the left atrium, okay? And remember that the posterior atrium, anterior ventricles, okay? بعدين, where is it exactly? Where is the site of the anterior surface? It's behind the sternum and the costal cartilages. So, back to the first lecture. هنا sternum, قلنا هنا we have the costal cartilages, obviously, but they're not seen here in the diagram. And we have the sternum, right? قلنا the heart is here. The heart is in the yellow part. So, it's right behind them. So, that's why we said the anterior surface حقتها is right behind the sternum and the costal cartilages. تمام? بعدين here we have grooves. The grooves, I'm going to skip them. We're going to talk about them at the end because there's a whole slide about the grooves. Okay, so ignore the grooves for now. خلاص? بس remember this is the anterior surface. تمام? Now the last surface, which is the inferior surface or the diaphragmatic surface. So for the diaphragmatic or inferior surface, we need to know it faces downwards, it rests on the diaphragm, which separates it from the stomach and the spleen, تمام, and liver and all the other organs. بعدين it's formed mostly by ايش? We can see all of them. I mean, we can see the left atrium, the left ventricle, the left atrium, the right atrium, the left ventricle, the right ventricle. We can see all of them here in the inferior or in the diaphragmatic surface. عكس posterior or anterior. يعني قلنا في posterior we can see the atriums more, في anterior we can see the ventricles more, but here we can see them all equally, تمام? But which one is the most one that we can see? ايش? The left ventricle. Okay, we can see the left ventricle the most. Okay, now let's go to the grooves and then come back to the borders. Okay, so let's go to the grooves first. So we said إنه في grooves. Okay, what are the grooves أصلا? The grooves are زي حفر في الهايت من برا, the anterior surface. They're not like the septum. The septum is a muscular surface or the muscular part. The septum اللي يكون يفصل right والleft atrium والright والleft ventricles اللي يكون في النص. Okay, this is not like the septum. A groove or something else. Grooves are from the anterior part or the anterior surface of the heart. خلاص, they're like حفر يدخلوا فيها usually ايش? arteries, nerves, veins, all of these go through the grooves. Okay, we don't need to know what exactly goes in the groove. What we need to know are where the grooves are, or where can we see these grooves. Okay, we have 3 grooves. This is a table I found, it summarizes them. خلاص, so we have the anterior ventricular groove. From its name, it's between ايش? It's between the atrium and the ventricle, anterior ventricular. So it's between atrium and ventricle. And what's special about this groove specifically, the anterior ventricular groove, is also known as the coronary groove. That's the first thing. And the second thing, إنه it surrounds the whole heart. يعني يلف كده لفة كاملة على الهارت. Okay, it surrounds the whole heart. Okay, it's the only groove that surrounds the whole heart. It's known as coronary groove or anterior ventricular groove or AV groove يعني اختصارا. خلاص? So where is it seen, or where can we see this groove? We can see it here in the anterior surface and in the inferior surface. We can see them in both. So here we can see this is the coronary groove, خلاص, also known as the AV groove, so the coronary groove. And then يلف من ورا, and we can see it here in the inferior part. So here we can see the coronary groove as well. Okay, so this is in the inferior view. We can also see the coronary groove. Okay, what are the structures that pass through the coronary groove? Everything اسمها coronary. يعني coronary artery, coronary vein, coronary sinus, anything coronary is going to pass through the coronary groove. تمام. Most importantly ايش هنا in the inferior surface, خلاص, the structure that passes through it is known as the coronary sinus. What is the coronary sinus? It's basically the vein حق الهارت. So it's the vein for the heart. طيب, why didn't we not call it coronary vein? لأنه it's too wide and dilated to be known as a vein. So that's why it's too big to be a vein. So we call it sinus. So that's why it's coronary sinus, which passes in the coronary groove seen in the inferior surface. Okay? So this is the first groove. The second groove is the IV groove or interventricular groove. Interventricular, from its name, it's between the 2 ventricles. طيب, it separates the right and left ventricle. And it's divided into 2 parts. Anterior interventricular groove, posterior interventricular grooves. يعني anterior IV groove and posterior IV groove. Where can we see them? In the anterior surface, from its name, in the anterior surface, we can see the anterior IV groove or the interventricular groove. So this is the anterior interventricular groove. تمام? Where can we see the posterior? This is where the doctor said a lot of confusion happens. The posterior interventricular groove is seen in the inferior surface. It's not seen in the posterior surface. يعني when you see posterior interventricular groove, خلاص, automatically you're going to be like, oh, خلاص, it's in the posterior surface. لا, it's not. It's in the inferior surface. So remember, the posterior interventricular groove is in the inferior surface of the heart, not the posterior surface of the heart. Okay, the anterior is in the anterior عادي, but the posterior is in the inferior. تمام? So this is the posterior interventricular groove seen in the inferior surface, and the anterior interventricular groove seen in the anterior surface. تمام? The last groove we have, we can't see it, it's invisible, it's hidden. خلاص, it's known as the intraatrial groove. Okay, from its name, it's between ايش? The atriums. So why can't we see it? لأنه it's covered with the vessels. هنا it's supposed to be seen in the inferior surface, but we can't see it لأنه it's covered with the vessels هنا, all of them, so we can't really see it. It's a hidden groove, but we have to know it, إنه it's in between the right and left atrium. Okay, so كده we're done with the lecture. These 2 slides or these 3 slides are for revision. The doctor said we can use them برضو for OSPI. So I labeled them. You can also use them as practice and try labeling them yourself, and use the ones that are on the original slides that are empty and try labeling them. Okay, so we can see here all the structures that we mentioned about the height. Tamam? Okay, so I realized I forgot to go back to the borders of the height, so this is a very important slide. So the borders of the height, what do we need to know in the slide? We need to know the names and the chambers forming each border of the height. Okay, so we have the right border here, and then we have the left border, the upper and the lower border. Okay, so they're color coded as you can see, so you can identify them easily. So the right border is formed by by the right atrium. And how do we know the right atrium? We know the right atrium from the vena cava. The vena cava is a very important structure which shows us where exactly we're on the height. Yani, are we on the right? Are we on the left? Where are we? So once we see the superior vena cava, we're gonna see where it opens, and that area or that chamber is gonna be the right atrium. Okay, so this is the right atrium which forms the right border of the height. بعدين the left border is formed by ايش? It's formed by the left ventricle, but it also has another structure known as the left auricle. What is the auricle, or what is the left auricle? Ear-shaped structures. They're very small structures, ear-shaped, and it has muscles inside. What are these muscles useful for, or what do they help in? They help in the contraction of the atrium. Okay, so the auricles help in the contraction of the atrium because they have muscles. Okay, so this is the left auricle, and it forms part of the left border of the heart. So the left auricle and the left ventricle form the left border of the heart. Then we have the lower border, which is formed by it's formed by the right ventricle and the left ventricle. Yani the inferior border or the lower border is formed by ventricles only, but mostly the right ventricle. تمام? And then the superior border or the upper border is formed by it's formed by the two atria. Okay, so it's formed by the two atria. تمام?